Dry cough, what causes it and how do you treat one? A dry cough can have many causes, from allergies to viruses. Home remedies and OTC medications may help provide relief. What is a dry cough? A cough is a reflex action that clears your airway of irritants and mucus. There are two types of cough, productive and non-productive. A productive cough produces phlegm or mucus, clearing it from the lungs. A non-productive cough, also known as a dry cough, doesn't produce phlegm or mucus. Many things, from allergies to acid reflux, can cause a dry cough. In some cases, there's no obvious cause. Regardless of the cause, an ongoing dry cough can seriously impact your day-to-day life, especially if it's worse at night. Keep reading to learn more about the possible causes of a dry cough and ways to find relief. Common causes asthma. Asthma is a condition in which your airways swell and become narrow. Asthma-related coughs can be both productive and non-productive, though they're frequently non-productive. Coughing is a common symptom of asthma, but it's usually not the most prominent one. However, there is a type of asthma called cough variant asthma that includes a chronic dry cough as its main symptom. Other symptoms of asthma can include wheezing, shortness of breath, tightness or pain in the chest, trouble sleeping because of wheezing or coughing. Coughing or wheezing attacks. Long-term asthma treatment often involves long-acting medications like inhaled corticosteroids, such as fluticasone, Flonase, Flovent, triamcinolone, Asmacort, budesonide, Pulmicort. Short-acting medications used for the treatment of occasional asthma attacks include bronchodilator inhalers such as albuterol, Proventil, Ventolin. These can also be part of a long-term treatment plan. Gastroesophageal reflux disease. Gastroesophageal reflux disease, GERD, is a type of chronic acid reflux. It happens when stomach acid regularly flows back up into your esophagus, which connects your mouth to your stomach. Stomach acid can irritate your esophagus and trigger your cough reflex. Other symptoms of GERD include heartburn, chest pain, regurgitation of food or sour liquid, the feeling of a lump in the back of the throat, chronic sore throat, mild hoarseness, difficulty swallowing, postnasal drip. Postnasal drip refers to extra mucus dripping down your throat. When you have a cold or seasonal allergies, the membranes in your nose respond by producing more mucus than usual. Unlike healthy mucus, this mucus is watery and runny, so it drips easily down the back of your throat. Postnasal drip can tickle the nerves in the back of your throat, triggering a cough. Other symptoms of postnasal drip include sore throat, the feeling of a lump in the back of the throat, trouble swallowing, runny nose, coughing at night. The treatment for postnasal drip will depend on what's causing it. It's usually the result of allergies, a bacterial infection, or a virus. Viral infection. When you contract one of the many viruses that cause the common cold, your short-term symptoms usually last less than a week. It's not uncommon, however, for a cough to linger long after your other symptoms have improved. These post-cold coughs are usually dry and can last for up to 2 months. They're usually the result of irritation in your airway, which is often overly sensitive after a viral illness. Upper respiratory infection. An acute upper respiratory infection, URI, is a virus or bacteria that infects your nose, throat, pharynx, larynx, and bronchi. In addition to the common cold, URIs include sinusitis, pharyngitis, tracheobronchitis. The common symptoms of a URI include coughing, runny nose, nasal congestion, sneezing. You can treat coughing caused by a URI with cough suppressants and expectorants. Allergies. When your immune system mistakes a harmless foreign substance, such as pollen, for something dangerous to your body, it attacks it. This causes allergy symptoms such as coughing. Dry cough treatment and home remedies. Dry coughs can be difficult to treat. Once your airways become overly sensitive, they're easily irritated by coughing, creating a vicious cycle. There are a few things you can do for relief, regardless of what's causing your cough. Dry, sucking on throat lozenges to moisturize and soothe irritated throat tissue. Taking OTC cough suppressants, such as dextromethorphan, Robitussin, To suppress your cough reflex, adding honey to a hot drink to soothe irritated throat tissue. You can also try these natural remedies for coughing. How to prevent a dry cough. To help prevent a dry cough, drink plenty of water to help keep your throat moist. You can also try eliminating what's triggering your dry cough as follows: environment irritants. Use an air purifier to remove allergens or a cool mist humidifier to add moisture to the air. Vacuum frequently to get rid of dust as well as pit hair and dander. Food allergies. Avoid particular food or foods that are high in histamines, such as aged cheeses, fermented or pickled vegetables, and alcohol. GERT. Avoid acidic and high-fat foods.